Embracing digital healthcare. Are we really prepared? We've got a great panel with us. Dr. Nitya Khemka, who's Director of Bharat, Sumit Sharma, Partner, IMEA, Head of Health and Life Sciences at Oliver Wyman, and Andrew Cowen, Founder and CEO, Future Care UK Limited. Thank you all so much for being with us. Dr. Khemka, I'm going to start with some of the sort of experiences that you have had with Bharat and others. How do you take, what are the sort of ways in which you're seeing digital technologies can actually transform healthcare? Because healthcare has been a problem for a long time. It's a problem in many countries around the world. And there's a hope that digital technologies can take us to the next level.
Thanks, Vikram. Before I come to the examples, I want to allude to some macro trends. The first is governments in the global south are moving from being public service providers to being facilitators in providing the digital infrastructure. Secondly, there's a marked shift in the origin of the development of this innovation. Before, it was being innovated in the global north and being deployed in the global south. Now, a lot of this innovation is happening indigenously. Thirdly, we've seen the huge revolution in terms of digital technology in impacting outcomes and of healthcare and usage of healthcare. And nowhere has this been more evident but during COVID, where we have things like remote clinical monitoring, contactless care, and things like telemedicine. And this has really impacted the last mile, the hitherto underserved previously. So really impacting access and utilization of care. We are now moving towards a digital commons approach. And in India's case, it is the Ayushman Bharat Digital Missions Framework, which is an interoperable digital system and characterized by human-centric design, bottom-up, user-friendly, co-created with the citizen, as well as the service provider, multilingual and easy to use. And you talked about examples, and I want to give you the example of the Government of India's Cowen platform, where during COVID, 1 billion users were registered and 1.78 billion people had their vaccines administered, covering 80% of the population, which makes it the largest health information provider in the world. We also have the eSanjeevani app, which is the telemedicine app of the Government of India. I was reading an impact study that it saved about 21 kilometers per patient served and nearly 1,000 rupees. PATH, which is the organization I work at, works in Satara district in Maharashtra to really integrate frugal health technology into the backbone of the primary healthcare system to move the needle on access. And we're looking at 11 digital solutions deployed across the public health service delivery landscape, building really a tech-led continuum of care. And then finally, to finish, I wanted to talk about some of the innovations happening in Kenya. There is the SMS for Life program, which is the SMS service for maternal and antenatal care. Something similar in Bangladesh, the Uponjon text for maternal and child health. And then finally, there's eHatid in the Philippines, which is a very interesting mobile health information system to manage data in the Philippines. So a lot of innovation at the bottom of the social and economic pyramid in order to improve outcomes and access.
Right, so there's a lot of clear work that is being done out there. You were just talking about the Ayushman Bharat digital mission, apparently inspired partly by what the NHS has also been doing. And Andrew, if you could just share some other light on what you've been speaking up from the NHS and the other work that is being done to get digital technologies into healthcare.
Well, from a ground bottom-up approach, we're a small SME, but very cerebral. The main problem, first of all, is the use of data and the differentiation of data from the device, because actually what we want is the data, assuming that it's high quality, of course. The other area that I think that the NHS are exploring are the combination of data sets that are being used to extrapolate specific programs within the communities and also within certain healthcare pathways. So it's a wide area around data collection, use of data, but somewhat hampered by some regulatory views that cannot separate hardware from the actual quality data that the hardware is developing. And that's, to some degree, the barrier which the NHS is struggling with. The other amazing initiative, which I hasten to add I was talking about 20 years ago, is the Pharmacy First initiative, where they're trying to use the high street as a health hub. And I think that that goes for any society across any country. We are not using the resources of what's in the local community to deliver the healthcare services that could be managed locally, rather than having these bastion institutions which you have to go to, etc., that involve travel and difficulties. So yeah, so it's about outreach, using data, using points of access to validate healthcare at the point of delivery, and how the high street or in other communities can be empowered to provide those services locally at point of care.
Right, Sumit, let me just go into that some of those barriers, and specifically the regulatory and compliance challenges that companies are going to face. I mean, look, let's face it, data and the possibility of being able to use data or AI when it comes to medicine, when it comes to personalized treatment, all of those are obvious opportunities, and that's probably the way healthcare is going to go. But then there are other concerns which you then have, the possibility for misuse, the privacy concerns. How do you navigate the regulatory and compliance problems out here?
Look, yeah, Vikram, great question. I see it as any other industry. We have seen that in the banking sector. We have seen it in the e-commerce world. Huge regulatory barriers. There could be frauds. There's going to be leakage. There's going to be misuse of the system as well. How do you do it? Well, you've got to actually get serious about digital. I don't think the healthcare industry anywhere in the world, I have worked in first world developed nations, underdeveloped nations, some in Africa and other places. I think fundamentally healthcare needs to have that paradigm shift towards, look, we can actually have technology to help us transform healthcare. I think it's still considered a very headline message, we want to do it. I don't think anyone does it properly. So that's when you get the right talent, you get the right ecosystem of technology in healthcare, you will actually then have the compliance regulatory frameworks developed, just like other industries have. Banks have done it, financial services, insurance, many others, where you have a lot of frauds, a lot of misuse. And essentially it is about getting serious about technology and using digital. And great examples here today, but I can tell you there are 800,000 digital health programs worldwide, and we still can count maybe 10 or 15 that we are proud of. And 99.9% of the times it is because of the lack of having that technology vision around it. Yeah.
Would you think that healthcare is one of the first major industries to be completely revolutionized by AI? That's possible.
Not yet.
Many people
It's possible, but not yet. I don't think we should take away the human touch because ultimately we are humans, and healthcare is an emotional industry as well. So we have to keep that.
Would you agree with that?
Yes, I 100% agree, and I think one of the abilities to be able to fix some of that is adoption. If we don't have adoption, then whatever itsy bitsy technology, intervention, service, you're not going to get the buy-in. You're not going to get the commitment. So essentially, what's I think missing in the mix of things, in a multifaceted and very complex environment, especially post-COVID, is the education element. How can we get doctors to understand the use of technology, even within their day-to-day work practices? I don't think, my colleagues are looking into it at the moment, but I don't think there is an educational program that supports doctors, your local GP, in taking up some of these technologies and saying to their patients, what are you wearing today? What data can I take from that? And how can I add value to the diagnosis that I'm going to provide and avoid it being escalated? And I think that if we had that educational process and be able to prescribe technologies like we prescribe medicines, so it's the same sort of database, same sort of principle, we could actually harness the telecare services and educate GPs in utilizing primary care and health professionals in the wider context. We could actually educate and help people use those technologies. The maternity is a perfect example of delivering support at home in the home for women who basically do not have access to resources or facilities.
So, Dr. Khemka, that also leads us to the entire question of inclusion, right? Because with digital technology becoming more and more ubiquitous, everyone has access to the internet and phones and all that, including in the most remote parts of the country. Do things like telemedicine, the ability to get consultation, actually help in taking healthcare to the last mile, taking quality healthcare to rural areas, to remote areas, or no?
Vikram, great question, and there are three themes I want to answer your question within. The first is, absolutely, it is inclusive, but we need to go the extra mile in order to make it accessible. And I'm talking about we need to understand the diverse needs of the population. Who are these end users? We need to co-create these solutions with the citizens along with the providers. We need to develop content and interfaces that are culturally appropriate, but also linguistically accessible. We need to design user interfaces that are easy to use, that are intuitive, easy to navigate for the digitally illiterate. And I'm thinking of voice commands, text-to-speech, etc. And we need also, most importantly, we need apps that can function offline when there's limited digital connectivity. And the final theme is I really want to talk about policy and regulation. Andrew alluded to it. We really need to advocate for policies that can ensure access for all. We need to implement robust data. Sumit talked about security and data settings. And then finally, we really need to strengthen the digital public infrastructure for health. And I'm talking about frameworks like the WHO's Global Initiative on Data for Health, which is really designed to improve alignment of digital health for government and partners. So these are very key in order to make it more accessible for all.
But increasingly, are you finding, the work that you're doing, are you finding people in rural areas, in places like Satara, others, being able to use digital technologies effectively?
Yes, increasingly we are, because with mobile penetration in countries like India, everybody has access to a mobile phone. And things like telemedicine, while they live very far away from the clinics, in a sort of hub and spoke model, they're able to be connected to these hospitals at the taluk level and the district level and get the care that they deserve and be triaged to be taken to the district level hospitals. So huge progress.
Right. Sumit, you want to add something to that?
For me, I've always said healthcare is not a healthcare problem. Healthcare is a national problem. And just to get that right, you need to have a lot of ecosystem alignment. You need to make sure that your telcos, your Airtels of the world and Jios and others have connectivity, because if you want to have a video consultation with a 3G, you're not going to be able to connect. There are cases that we have seen that it works really well in certain states and it doesn't. So that consistency, that alignment with other parts of the economy is very, very important to deliver digital health. Otherwise, doctors won't change, because doctors, nurses, caregivers are always going to ask that question. How is this enabling me? This is actually disabling me, because the patient's still calling me back to ask that same question because I couldn't deliver it digitally. So, get the technology infrastructure right, the other sectors also playing that active role, insurance, everyone else coming together at the right time.
Right. When it comes to, the examples that you will take from what's happening in the emerging world or the developing world, but if you look at even the developed world, the challenges around healthcare seem to be pervasive and existential. If you look at the United States, for example, the amount you have to pay, the entire reliance on insurance. If you look at the NHS, the time that sometimes you have to wait to get an appointment with a doctor. Healthcare is still a problem that we're not being able to sort what is the right way to do it. If you had to build it ground up using digital technologies, what would you be thinking of?
I would say that there should be a body that looks at not the hardware, but the quality of the data and the way that data can be utilized for the benefit of all. I think protection insurance companies like First Farm in America, Vitality, are on the cusp of that process, Bupa, etc. They're playing with these ideas of reach out and but supported predominantly by data collection. I think that is the key to a transformation, but also I cannot emphasize more strongly, if you don't have the education, that right down to even the local village chief or whatever community person, if they're not supported, then they can't implement and even provide an early phase of triage before you even get to the data. I think it's the education that we need to adopt these technologies, to change the way we think, and that's both at an institutional level, right down to the SME, the innovators who are developing this stuff that can be implemented if it wasn't so much for some of the barriers that we encounter and the lack of vision of some of the investors long term. You know, if you mention NHS in an investment scenario, you get put down 3 years and that's it.
All right. Andrew, thank you so much for that. Sumit, great having you with us. Dr. Khemka, thank you so much. All of
Thank you.
for being
Thank
with us.
you so much.
Thank you.
Vikram.